Good afternoon and welcome to our monthly webinar here at HPFY. My name is Laura Castricone and I'm a respiratory therapist. At the end of this presentation, you'll be able to ask questions if you'd like. Please use the raise the hand icon at the bottom of your screen. And for your watching and listening pleasure, it is being recorded and it will be on our YouTube channel in the future. So let's dive into this. Today we're talking about the dangers of untreated obstructive sleep apnea. So first of all, let's have a little review on what actually happens to you when you have sleep apnea. So just as a physiologically what happens is your airway closes or collapses down on itself when you sleep. And if you were to watch somebody without their shirt on, they're actually making efforts to open that airway because they have a mechanical obstruction at that time. But what happens is the oxygen levels in your blood will start to drop because you're not breathing. And once it gets to a certain point, it triggers a receptor in your brain to keep waking you up. And even though you're being woken up, you may not realize that you are. You're coming up to later stages of sleep or full wakefulness. And so you're having what we call arousals all night long. Also, a person that has obstructive sleep apnea that's untreated, they have no consolidated sleep. Their sleep is fragmented. They may have a few minutes here, be awakened, another maybe half hour here, be awakened. So that could go on hundreds of times during the night. The biggest problem with sleep apnea is that because you're not breathing, your body goes into a stress response and it starts to release cortisol, which is the fight or flight hormone that we have in our body. Great when you're being chased by a lion, but not so great when you're in bed and it's dumping the cortisol into your system, which is made up of mostly sugar. So what happens is because of the cortisol release, the body weight starts to go up and the patient can develop diabetes as a result of that. Lack of sleep also can lead to problems with your job, problems on the road. You can get into a car accident. You can end up with problems with your relationship. I've seen many couples split up because they don't understand what's going on with the other person. And if left untreated, it can lead to heart failure and serious heart problems. But it is a treatable condition. So some of the problems that are associated with untreated sleep apnea, and one of the most common, these are the two most common that we see, diabetes and hypertension. So if you have diabetes of unknown etiology, like in other words, you don't have a family history of it, you never had a problem with it before, and it suddenly comes on, it could be a secondary effect of untreated sleep apnea. Because as I said, your body goes into that fight or flight response, it starts to release cortisol. Cortisol starts to raise the blood sugar levels. It causes you to gain weight, and the weight gain can lead to diabetes and those high blood sugar levels. As far as hypertension goes, just remember that when you're not breathing, as those are periods of apnea, or when you have minimal breathing, not enough oxygen is coming into the body because you're not breathing. So as your oxygen levels start to drop, it makes it harder for your heart to pump the oxygenated blood to the rest of your body, which your muscles needed to function. And just remember, your heart is a big muscle, so it also needs oxygen to function. So if you're depriving your body, all the muscles in your body of oxygen, you're also depriving your heart of oxygen. So it leads to increased work of breathing and increased work of the heart, which can cause the heart to increase in size, and it can cause hypertension. And then there's a condition called refractory hypertension, where someone has tried 3 different blood pressure medications and the blood pressure hasn't responded to it. We know that that's usually a direct effect of untreated OSA. And usually when they treat the obstructive sleep apnea, that hypertension goes away. Afib. We know now that atrial fibrillation is almost directly associated to sleep apnea. You do get it from other conditions, but we see it very, very it's rampant pretty much with some of our older patients, and even some of our patients in their 50s will have AFib as a consequence of not treating their untreated sleep apnea. So it's because of a lack of oxygen to the heart, and it can be lethal. The heart can go into an erratic beat and not pump enough oxygenated blood to the rest of the body, including the brain, and it can be a lethal condition. A lot of times with AFib, you have to go and have a cardioablation, where you go into the hospital and they actually shock your heart like they would if you had coded, to try to get it to beat properly, because AFib is an improper arrhythmia, and it can, like I said, it can cause a lot of problems. So if you do have atrial fibrillation and you don't know where this came from, it would beg the question of whether or not you have some untreated sleep apnea that has to be looked into. Some of our newer literature tells us that dementia now there's a direct link between untreated obstructive sleep apnea and Alzheimer's and other dementias. So what's happening is two things: the lack of oxygen to the brain causes cognitive dysfunction and causes cognitive issues, because every time you don't get oxygen to your brain, it obtuns it. And also, we know that obstructive sleep apnea now causes certain proteins that are formed in the brain, those tau proteins that they know cause dementia and Alzheimer's. And they're seeing that more and more with people that have obstructive sleep apnea. They're seeing a correlation between dementia and obstructive sleep apnea. So it's very important that if you think you have sleep apnea, that you try to find a treatment plan. And we'll talk about that in a second. Falling asleep inappropriately and excessive daytime sleepiness. These are usually some of the outward things that people complain about, is that I'm so tired, even though I slept a whole night, I don't feel like I slept at all. Or they find themselves, especially on drives to work or long drives, that they are nodding off at the wheel. So even though you slept for 6 or 8 hours, you can still fall asleep or while performing routine tasks. We've seen people get injured on their job, who work on assembly lines or in industries where they might fall or fall asleep while they're performing their job. I've also seen patients lose their job because they fall asleep inappropriately at their job, and their boss does not understand why they're sleeping at their desk in front of their computer. So you can get a doctor's note once you've been identified, but it'll be for a short duration. But if you are struggling with that, have a frank conversation with your employer and let them know what's going on, that you are going to seek some treatment. Car accidents and injuries, very, very common to get drowsy behind the wheel. People that don't have obstructive sleep apnea do that as well. But one of the reasons they put those rumble strips on the highway, you probably see them in the gutter on the highway or sometimes in the center of a secondary road, is so that way if you get drowsy and your car starts to go off the road, they're hoping the rumble strip will wake you up and get you back to right your car back on the road. Some states have very strict laws that if you have untreated sleep apnea and you fall asleep at the wheel and you injure somebody, that you will be directly liable, as far as even imprisonment if this person is killed. So you have to be careful. There's a lot of states that are drafting laws like that. Also, if you're a truck driver, the truck driving industry is now going through many, many changes when it comes to sleepy driving. As an industry, they have been bucking this for years, but it's coming down the pike that everybody that has a CDL license will have to be tested for OSA. If they have OSA, they have to be treated and they have to prove that they're using a CPAP or some other way to get rid of the problem so they can continue to drive a truck. It also causes social and relationship issues. You can imagine being at a party and falling asleep while everybody's having a good time. Or every time, your wife wants to, or her husband wants to go to dinner, you can't because you're too tired. Or you can't go to a movie because you fall asleep at the movies. You can't read a book. You can't even sit and watch television without being drowsy. And it can cause a lot of issues between couples, especially if they don't understand what the other person's going through, what they're suffering with. So this is another big one, is lack of sex drive or decrease in your libido. The lack of sleep actually changes the body chemistry. So it can decrease the sex drive dramatically. Not only the fact that you're tired and may not be in the mood to have sex, but also that your sex drive is lower because of the chemistry changes in your body. And obviously performance may suffer. And obviously lack of sex drive can change the dynamic between partners. So it's important to keep an eye on this. If you're finding that without other things involved, that your sex drive is just low and you don't really know why, but you're tired all the time, it could be that you have some underlying sleep apnea that needs to be taken care of. Depression is a very big thing because a lot of these other conditions can cause you to have depression. If you have a lack of sex drive, if you're always tired and you feel like you can't really go out and do things and enjoy your life, then you probably will suffer from depression. As a matter of fact, sleep apnea can cause direct depression by the changes in the brain chemistry. And approximately 50% people that have obstructive sleep apnea suffer from some sort of anxiety or depression problem. So it's very, very rampant. And as we all know, if you're a little fatigued or very fatigued, you can become very irritable and you have a difficult time focusing on getting projects done and things done. And we have a lot of mood disorders that are associated with untreated sleep apnea, anxiety, depression, a lot of PTSD. A lot of people that have PTSD also have untreated sleep apnea. So what else can you do and I wanted to include this slide and I should have. What can you do if you think you have untreated sleep apnea and you need to be treated? First of all, jot down the signs and symptoms that maybe your partner has noticed or you have noticed. And if you live alone, you may not notice much, but you may be tired all the time, inappropriately tired. Like even though you were in bed for 8 hours, you may still be tired in the morning when you wake up. That's an indicator that something is going on. So keep an eye on excessive daytime sleepiness. If you're starting to have cognitive changes, if you're starting to get forgetful, of unknown etiology, in other words, they haven't diagnosed you with anything that would make you forgetful. It could be your underlying sleep apnea. You haven't treated that, and your brain just can't carry that much information, especially when it's tired. So you may find that the best thing for you to do is jot down your symptoms, seek some treatment by talking to your primary care physician first, or a sleep specialist if you're allowed to do that with your insurance. Insurances cover those type of visits. And if it warrants it, the sleep doctor will have you tested. And just to let you know, you don't have to actually go to a sleep lab these days because they have home sleep testing. So it's easy to get tested these days. It's private. No one has to know you're being tested for sleep apnea. And this way, once you get your diagnosis, you can start to talk to your physician about what treatments are available. From surgical treatments to using a CPAP or a bi-level machine to diet changes and lifestyle changes. So if you do have or suffer from some sort of obstructive sleep apnea, or you're suspicious that you may, seek out some information and get the best direction that you can. Not everybody can tolerate CPAP, not everybody's a candidate for surgery, but your doctor will have some sort of plan moving forward to help you with it. I do see we have some other people here along with us. Do you have any questions? I'd love to be able to answer them for you. No questions? Well, as always, we thank you for being here. Hopefully this was interesting. There's a lot of information on sleep apnea. You should be sure to do some research if you think yourself or someone that you love might be suffering from it. And we do see it in children as well. So keep an eye on everybody. And snoring is a big warning sign. So if you snore or gasp for air at night, there's an indicator that something is obstructing that airway. Thanks for being here again. Once again, it'll be in our YouTube channel. And you can reach me if you want to ask me questions privately. My email here is Laura, Laura, @hpfy.com.